All right, every once in a while, we like to take the time to clean out our inbox and answer some viewer questions that we haven't been able to get to. After all, the 208 is supposed to be a conversation, a two-way conversation. So let's do our part and try to respond to some of what you've asked us, like this one, which several of you have asked this week. PJ wants to know, I'm curious about the optics of the COVID-19 testing backlog. As those backlogged cases are processed, do they show up as cases on the date the test was taken or the date it was logged into the computer? How is this all sorted out? Similar to what Anita texted in, are the positive COVID cases and deaths numbers actually day of, or are they backlog cases combined into actual day numbers? That's what Anita asks. Well, this is something we've been talking about for several weeks now. Right now, though, statewide cases show they are trending downward, these numbers, but the Department of Health and Welfare has been issuing warnings to take that trend, the numbers, with a grain of salt, because there are still about 2,900 backlog cases that still need to be processed. That seems like a lot, but that's actually down from the nearly 11,000 cases a few weeks ago. The problem lies in the local public health districts and not enough hands to help get the influx of cases processed in a timely manner like we've been used to seeing throughout the most of the pandemic. So once they are processed, where are they actually tallied? Well, this is a look at the daily case counts. There are cases that are announced every day, confirmed and probable, like yesterday, for example. There were 1,328 cases reported to the state. Compare that to this illustration of the onset date of cases. These are the cases that have been reviewed and processed, meaning they have been confirmed as a positive case and they can pinpoint a date. But this chart's still missing those 2,900 cases we mentioned. So far, only 3 of yesterday's cases have been fully processed. So that white bar signifies the dates which illnesses may still not yet have been reported right there, meaning cases, more cases I should say, are likely to appear. So bottom line, once they figure it all out, COVID cases are logged from whence they came. All of this, by the way, is available on the state's COVID-19 dashboard. Then there's this one from Joni. On the sewer issue, how long would the increased rates apply or remain? Joni's talking about the Boise sewer bond that will be on ballots this election day as part of a long-term plan to expand the city's wastewater treatment capacity and replace some aging infrastructure. So here's some background. If voters approve the bond, water renewal rates would increase about 10% or about $3.64 per month. If it fails, that rate jumps to about 53% or an average monthly increase of $19.51 per month. So how long will those additional fees last? The city of Boise says right now it looks like it's going to be based on the length of the financing. The city says they're assuming it will be a 30-year payment, so 30 years would be the answer to that question. However, variables can change how that would impact the need or decrease the increase or decrease or increase those rates. And to be very clear, this isn't your water rate that is going up with this. This is your water renewal rate, which is a fee based on water usage in the winter, which is calculated in hundreds of cubic feet. And this is also a bill you likely get every other month if you are in the Boise sewer district. So there's that. Well, finally, there's this one. What happened to the to the basset hound we showed you just last week? Was that just a tease? The basset hound. I've heard something about a Mo, right? This is a dog we've heard about. See what happens when I go on vacation. All these things kind of get passed through. I've just been handed this note, by the way. It seems that on some Fridays now, according to Joe, the 208 is going to be known as the 2-Mo-8. All right? So here's your Friday dose of 2-month-old Mo. Hey, Mo.